And this morning, we are staying on top of the latest developments in the coronavirus outbreak that you need to know to keep yourself and your family safe.
We begin with signs that social distancing might actually be working. North Carolina health officials now predict the number of cases will peak in May and not in mid-April. That's because social distancing is helping flatten that curve out. 100 American Airlines flight attendants, they've tested positive for coronavirus. The airline employs 11,000 people in Charlotte. Many local workers say they are concerned about community spread. The union says American will give members the option to wear face masks now. And this week, North Carolina Governor Roy Cooper is expected to issue even more executive orders. These are new ones to strengthen the state's social distancing guidelines.
And one of the biggest concerns for the governor is how are businesses implementing these social distancing guidelines?
Reporter Anthony Castura is in Midtown this morning with a look at some of the options that Governor Cooper is now considering this morning. Anthony?
The governor is concerned that some of the stores that are open right now are not requiring shoppers to follow those social distancing guidelines. And he's also concerned that there's too many shoppers in some of those stores altogether. And so part of this executive order would include a limit of people who are inside of those stores, and it would require a minimum of 6 feet between shoppers. Now, yesterday at a news conference, the governor specifically called out Trader Joe's, like the one behind me, as a grocery retailer who is doing everything correctly. But now it could be mandatory for all businesses. Governor Cooper is getting input about what restrictions would best serve customers and workers. So far, it could include one-way aisles, mandatory plexiglass installations at checkout, and limiting the number of people inside based on the store's maximum occupancy. We've told you about other companies like Lowe's, Harris Teeter, and Publix implementing those changes. But at that news conference yesterday, Governor Cooper said he wants to make the measures more uniform. He doesn't want people to be afraid to go to the grocery store or pharmacy to get essential items, but he does want to discourage people who go just to have something to do.
Now, I know many stores have already put limits on how many people can be at a store at once, and this order will ensure those limits are mandatory across the state for retailers.
A separate executive order would require businesses, including grocery stores, to install guardrails to help shoppers keep their social distance. The governor says he expects to sign those new executive orders sometime this week. John?
Now, Anthony, the governor did also mention another executive order. This would help essential workers that need child care.
Yeah, it is a new program. This one is actually called the Emergency Childcare Subsidy Program. And this is slated to not only help emergency workers who are working on the front lines help find childcare, but it would also actually help them pay for it as well. The state created a hotline for families needing that emergency childcare, and we want to put that on the screen for you right now. The number is 888-600-1685. Again, that's 888-600-1685. Childcare teachers and staff who are working at centers that have agreed to take in the children of essential workers will also get bonuses in their April and May paychecks. Full-time teachers will get $300 per month, and other full-time staff will get $200 per month. Part-time workers, though, are also eligible for those bonuses. Those child care centers will also follow specific guidelines, including daily health checks of the 20 to 25 kids that they watch on a daily basis. John?
Anthony Casura live for us this morning.
There is a concerning trend nationwide that coronavirus is infecting and killing African Americans at a disproportionately higher rate than others. The New York Times reports that that could be due in part to 4 key factors. First is a job disparity. Many African Americans don't have the luxury of working from home and are at greater risk traveling to and from work. They are also less likely to be insured and more likely to have underlying medical conditions that make it harder to recover. And the Times found racial bias is also a factor. African Americans are less likely to get a referral for testing when they visit a clinic. And the Times interviewed Mecklenburg County Superior Court Judge Donnie Hoover. He and his wife Josephine told our Glenn Counts last night. Both tested positive, and the judge has this message for anyone who thinks this won't happen to them.
Well, first of all, people need to take it seriously. You know, staying in the house, staying away from other people, because you don't know who has it.
Judge Hoover also says this felt nothing like the flu. He says it is very draining, and just doing household chores feels like quite a difficult task. Now, we dug a little deeper into how this is impacting our community, and we did find there's a clear disparity in Mecklenburg County when it comes to race and COVID-19. African Americans make up more than 43% of the coronavirus cases in the county as of April 4th, but less than 33% of the population. And some commissioners said there is reason for concern about those numbers. Hospital officials want to do more testing so they can dig deeper into those numbers and better understand them. And in North Carolina, Judge Hoover and his wife are just two of the more than 3,200 people diagnosed with COVID-19. 354 people are hospitalized and 46 people have died here. In South Carolina, 51 people have died from the virus. There are now more than 2,400 cases statewide. That includes 15 in Chester and 108 in York County.
Medic is interacting with dozens of patients every day, but among the first responders, they've still only had one confirmed case of COVID-19. Medic's deputy director, Judge Studnick, says that they are taking all the steps they can to try to ensure that their staff members are safe. Paramedics encounter about 40 patients every day with coronavirus symptoms, and between 5 and 7 of them end up testing positive. We did ask what a sudden spike of cases within Medic would mean for them.
That process requires the use of administrative personnel who are dual certified as paramedics to come out of their administrative roles and respond. The use of manipulating schedules to increase hours and increase overtime that would have to be worked.
Medic has enough personal protective equipment for the moment, but they are still waiting on a new shipment to come in from their supplier.
And the YMCA in Charlotte is asking people not to cancel their memberships during the closures. They are automatically converting those fees to a charitable donation that you can claim on your taxes. That's if you choose that option. And while they're closed, the Y is providing emergency childcare for healthcare workers within the Novant and Atrium healthcare systems.
These are ways that we can serve without having our members, unfortunately, be able to come in right now. We're still doing everything we can to try to be helpful to the community.
Now, you do still have the option to pause your membership, and then you can resume it when the Y reopens.